A brain tumor is a mass or growth of abnormal cells in your brain. Tumors can start in the brain, or a cancer elsewhere in the body can spread to the brain. And to know more about brain tumor, we have with us today Professor Dr. Siddhartha Ghosh, Head of the Department and Director, Department of Neurosciences at Apollo Hospitals, Chennai. Good evening, Doctor.
Good evening.
What is a brain tumor, Doctor? Given today's incidences of people coming to the hospital with a small headache, assuming it to be a tumor, what are the incidences, Doctor, today?
See, well, the brain tumor is just like, it's just like a growth, as you have rightly pointed out. It's just like a new growth inside the brain. Now, the brain is a compact structure. So when there is something which new comes in the brain, which is not the structure of the brain, then it forms a mass there, and the patients have problem because of that. So that is what is brain tumor. It actually happens because there is some mutation which takes place in our DNA. So anybody can get a brain tumor at any time. So and it starts producing symptoms depending when it's a location and the size and so many other factors. So this is what brain tumor, like it's a growth anywhere, like anywhere in the body. When there's abdomen, there's abdominal tumor. It's a brain tumor. So to answer your second questions, like the incidences, it's not that anybody comes in headache, we have to worry that, oh, I'm having a brain tumor. It's not like that. See, the commonest cause of headache is like what all of us get, which you call it a vascular headache, which may be tension related. It can be a migraine. So there are so many other types of headache. So we don't have to worry about that when you get a headache, that okay, I have probably, am I having a brain tumor? Not like that. So, but there are some features which will come later on. Particular type of headache, when it comes, then we have to be cautious. Okay, I should need to come to a doctor. That I will come to later on. And the incidence, like in if I talk about the India, it's about 5 to 10 per 100,000 populations. So it's about that. In United States, it's a little more. It's it is about almost every year about 200,000 people they get affected by the brain tumor. So, but India being a large population of 1.3 billion, ultimately it comes to like that about 40 to 50,000 brain tumor we get it. And one thing to remember, out of which the children, for example, the age group below about 18, 20% of these tumors, of the brain tumors, can happen in the pediatric age group. That's very important, and it's the second most common tumor in the pediatric age group after leukemia. So that's about that.
What are the early signs of brain tumor, Doctor?
See, that's what I was about to tell you, that when a normal healthy person, especially in elderly age group, somebody beyond 45, 50, started experiencing headache, which was quite severe to start with, which never had it before, or it's not that he gets one day and next day it's not there, and the headache persists for a long time, over a few days, is not getting relief. It continues for about a week. He takes paracetamol, but it continues. So it's an headache which persists for almost 24 hours, and then for some part of the day it's more. Normally it's like brain tumor headache is typically patient wakes up in the morning because of headache. This is something which is very peculiar. There are physiology behind it, which I am not going to that, but this is what very typical. Or even a young person who's been having this headache for a long time, we shouldn't neglect it. It may be a migraine, but then we should investigate to see, okay, whether we are not missing anybody. So anything which persists for a long time, that headache needs to be. That's one thing very important. Other thing is that this type of brain tumor headache normally quite some time will be associated with vomiting. They get a nausea and vomiting, and this vomiting relieves the headache. And the peculiar about this brain tumor vomiting, that after vomiting, normally if it's because of GI problem, when there's a vomiting, we don't feel like eating. It's a vomiting due to brain tumor, patient feels hungry after the vomiting, so they can eat. So headache, associated with vomiting is definitely needs to be looked into. Other thing is that very, very important thing is that seizures. Suddenly in a blue moon, somebody gets a seizures, whether he started trembling on his right side or left side of the body, he started associated with something like a speech loss. And so especially when it happens to the elderly people, or even in the young people who doesn't have any history in the earlier history in the childhood, or there is no family history, so some new onset of seizures, definitely it can be one of the manifestations of brain tumor. Other thing, as I told you, that the brain tumor is very located about it's very specifically site dependent. We are in the brain, there are so many parts of the brain which does so much of work. So depends on where the location is, the symptoms may be due to that. For example, if it is in the front part, in the frontal lobe, patient can have cognitive impairment, personality changes. Suddenly one person who is otherwise very reserved suddenly becomes very jovial, started making jokes. There can be loss of inhibition, there can be loss of urinary control, or if it is here in the posterior part of the brain, like near the back part of the frontal lobe, which is called parietal lobe, the patients can also have associated weakness. He might suddenly develop like a stroke. But the difference of a stroke with this brain tumor is gradually progressing. Slowly the patient finds that his one side of the body is not working, is gradually progressively becoming weaker. And if it's on the right side, because most of us are left side dominant, so right side, and our speech center is on the left side. So when it happens to a person whose right side started becoming weak, so he also have a speech problem, he will either have a problem of expression, or he may also have a problem of understanding, because this is comprehension. If it is in the posterior part of the frontal lobe, there will be more like a expression problem. If it is in the parietal lobe, it will be like a comprehension problem. Then it can be associated with, if it is a temporal lobe, especially on the dominant left side, patient can have a memory deficit. So like that. If it is in the back side, in the occipital lobe, patient can have vision problem. He may have problem of looking one side of the one half of his vision. Similarly, patients who have got cerebellum, in the back part of that we have a small brain which maintains our balance and equilibrium. So if somebody having a tumor there, a patient, or even in a young person, for example, child, parents started noticing that he's having difficulty in maintaining balance with a tendency to fall. So this is, okay, are we having a problem in the back side of the brain that we have to keep it in mind. So like that, there are so many areas. There are tumors which can happen in near our visual apparatus. There are some hormonal tumors which arises from the pituitary gland, which presses on the optic apparatus, and patients can present with vision problem on one side. So these are of various, there are so many types of symptoms. So anything which is not a normal part of our symptoms, something new, and when it persists for a period of time, involving our neurological functions, we definitely need to seek the advice of a doctor.
And are these symptoms the same in children as well?
Yes, some of the symptoms are common. For example, headache, as I told, headache associated with vomiting. These are common for both adult as well as the young. So most of the symptoms, but some of the symptoms come early in children. For example, this walking problem and all happens early in children, because there are some tumors which are common in children. For example, there is a tumor called medulloblastoma. It's one of the very commonest pediatric age group tumor, where the first symptoms will be the gait problem. So they don't have that much of problem, like as I was talking earlier, that this type of behavioral disturbance or memory problem. The pediatric age group tumor are more common in the cerebellum and that region, so they mostly, or in the brainstem. So they present with all this problem of the balance, or looking on one side, visual problem with the seeing double, or having a problem with the eyesight or rotation of the eyes. All these problems are more little common. So there is a subtle changes, but some of the symptoms are common, because sometimes what happens, the tumor blocks we have a drainage system in the brain called CSF drainage system. It's called ventricle. So some of the tumors block this ventricular system, and the patients can have severe headache, vomiting, and that happens more common in younger age group than the elderly age group.
How soon should a patient seek medical advice, doctor?
Yes, as I was telling you about this headache, when this patient, suppose a headache is something which comes and goes, and with a strong family history, young person, it's not that we have to immediately go to a doctor. Ideally, any headache should be investigated. Definitely. Nowadays, because the investigations are so easily done, so it's better to investigate. But when I told about these symptoms, which this type of headache, which is not really characteristic of our day-to-day headache, or this type of symptoms, or any aberrant like a neurological functions which was not persisting to us before, those symptoms it persists, definitely a person should seek medical advice.
What are the treatment options available for brain tumor today, doctor?
See, the treatment has to be divided in two parts. One is that it's what you call is a managing. How do you manage a brain tumor? So initially it needs to be investigated, then the treatment. So when a person comes with this type of symptoms, as I told you, first thing, which is very common nowadays, we can just get, which is nowadays available across the road. In almost every road we find a CT scan machine. So we should always get a CT scan done. That will give us a rough idea, okay, we are not having much problem, or we are having a problem. So after the CT scan, if the CT scan shows something, or CT scan is equivocal, not giving us query, can it be, can it not be, then the best diagnosis for any of the brain condition is MRI. MRI is the gold standard of investigations which is needed for a patient with the brain ailments, especially for brain tumor. So when you go to a doctor, even to a general practitioners, we have seen in various occasions that patients have, in my experience, I have really seen patients who have come to a doctors and who gone to a general practitioner for headache, and then some problem in the vision problem and all, has not been advised any investigations, and they later on has come with blindness. I have had experience with my patients that patients gone to the doctors, they haven't really investigated this headache or the neurological condition to the extent so much that the patient lost his eyesight. So that's why it's always better is always when the patients have headache or any sort of neurological conditions, it should be investigated. Gold standard is MRI. Nowadays MRI tells us every small thing, and now the MRI is more and more advanced. So we get almost 99% or 99% diagnosis with the help of MRI, that okay, what we are dealing with. So after that, suppose the MRI is suggestive of a brain tumor, then you have to, obviously the practicing doctor has to refer it to a specialist neurosurgeon, and then we have to deal with that. Now Obviously, there are not that we see a tumor and said, okay, immediately you have to go in for surgery. It's not like that. It is our decision to decide that whether that tumor needs surgery or not, number one. Number two, if it is surgery, how urgent it is. When do we do it? Can you wait for 1 month, or we can wait for even 6 months or 1 year? And then, or whether we do the surgery or we can avoid the surgery, do some other treatment if possible. So the treatment is surgery. Brain tumor treatment is surgery unless proved otherwise, because for the two reasons. As I told you, it is something new to the brain, and brain doesn't tolerate a growth because the brain is compact. And number two, we need a diagnosis what it is, because unless we know the diagnosis, we don't know. Though MRI gives a fairly good idea whether it's a benign tumor or a malignant tumor, but ultimately the histopathological biopsy diagnosis is very important, because if I send it to a radiation specialist, radiation oncologist, he or she will not do the treatment unless there is a biopsy proof what treatment, what is the pathology of this tumor. So that's why the surgery is definitely the treatment for a brain tumor.
What is minimally invasive scarless brain surgery, doctor, and how does it work?
See, previously, there was what is called the brain tumor surgery. There are still, it is, I'm sure, that majority of the surgeries we have to open a certain part of the skull. It's not that some people have concept when you do the brain surgery, you open the whole skull, not like that. As I told you, it's very location dependent. If it is in the front side of the brain, we open the front part of the brain. If it's in the back side, we the back side of the brain. If tumor in the skull base, so we go depending on that area. So opening is a small, but it leaves a scar. So when we do the surgery, we always try to give the scar beyond the hairline. Somebody who's got a tumor on the front side of the brain, obviously will not put a scar incision here, so that all throughout life he or she will leave a scar. So what we do is we give the incision beyond the hairline, so that even if it heals, when we operate, though the opening is small, we operate through the operating microscope or with endoscope, so it's okay for us to get. Then there are some surgery we can do through the nose, through the endoscope we do, or the microscope we do, especially for this pituitary gland tumor or some tumor which is on the lower part of the skull base, like a pediatric tumor called craniopharyngiomas, the other tumor called chordomas. There are quite a few tumors now, more and more coming as an endoscopic surgery. Now they are scarless, because you go through the nose, there is nobody would know what this, whether the patient had a surgery or not. And the supraorbital craniotomy, the advantage is that patient we can discharge in 2 to 3 days time. So they don't need to stay for 5 days or 7 days like a normal craniotomy. But all of them have a specific indication. So I cannot say that all surgeries can be done through the nose or all surgery can be done through the eyebrow. So there are some areas which we have to open the skull. But what we do is we open only that small part which is necessary, because we operate under high magnification. There are very highly advanced microscopes available or endoscopes available, which gives us a beautiful view of the location, the anatomical location we are going to do. So this is what actually what you meant by scarless. People generally talk about this supraorbital craniotomy or through the nose.
A lot of patients ask us about the possible side effects of radiotherapy. Could you please elaborate on that, doctor?
Yeah, so the common thing which is side effect that the patients may lose his or her hair. If it's previously when you used to give like that, do on both sides, from the side they lose this part of the hair. Earlier days people used to lose the whole hair. This has become less now, because the radiation therapy has become more specific, more conformal. So even they lose a small part of the here, and that generally grows over a period of 6 months to 1 year time. So that is one thing. Other thing, that the radiation itself can cause some changes in the brain. So previously, when the radiation was in a much cruder manner, one of the very common thing the patient used to have is severe memory disturbance, because the field of the radiation used to go laterally like that, and it used to fall on the one part of the temporal lobe called hippocampus. So that is very important for our memory. So the memory disturbance or a cognitive disturbance was very common those days, but now it is not so. It's much less, and whenever a radiation is given, the radiation specialist gives called hippocampal sparing, so that hippocampus is not affected. But even then, there can be some radiation induced changes in the brain. Now radiation induced changes can come as early as in 6 months, and it can last for years. It can come even after 10 years. So these radiation induced changes is what? Radiation causes some amount of changes in the white matter of the brain. It's called demyelination. So white matter changes, so that can produce some amount of neurological impairment of the patient's memory is one of the important thing, or they can even develop some amount of weakness of the body. And so this is very important, and which can manifest at any time. So these radiation induced changes again depends on how much dose is given, how much the brain can tolerate. Each area, the brain has got a tolerance of particular dose compared to the tumor dose. So brain normally can tolerate much more, but even then can happen. Now there is another thing which I'd like to mention here, that there are some people who have been given radiation for one particular, for example, we are given radiation for a benign tumor, can have another growth, radiation induced growth, even to the brain. That can happen. And so especially this, it's called ionizing radiations can happen. It can give rise to brain tumor. So this is what by and large it causes the side effect, and especially in children the radiation specialists are very careful. So normally below 3 years a child is not radiated because the brain doesn't tolerate. So if a patient comes, previously used to be 5 years, now with the more advanced radiotherapy technique, now they have reduced to 3 years. So those times if the patient has some tumor which needs to be treated, normally it is done by chemotherapy, not by radiation therapy, so that it becomes more tolerant.
Doctor, you're India's foremost neurosurgeons with over 40 years of impeccable neurosurgery experiences. You've performed over 20,000 neurosurgeries. Could you share some of your challenging cases experience with us?
Yeah, there are so many cases. It's difficult to really identify like that. But one case definitely we had. It was a very large brain tumor, which was actually presented in the conferences also. This was a young girl, she was 14 that time, and she had a very large tumor in the back part of the brain, and actually it was they had gone to even United States and all. They said no, it cannot be operated, and somehow through some contact they came to me, and then I saw the MRI and found that it's a benign tumor, so this girl can have a normal life if we can go through it. So I took this challenge. It was quite a bit of challenge, because it's not only involved me, it was a teamwork, involved the head and neck, because it was coming down the neck to even up to the upper part of the neck, mid part of the neck. So it was almost 10 centimeter tumor. The child it's born through the birth, and it's grown this big. and we had to involve the vascular surgeon because one vessel had to be compromised, and that has to be re-anastomosis so that the patients don't have a vascular episode. Then we had to involve the plastic surgeon because one part of both of the skin and the muscle had to be taken off, and that has to be repositioned with another flap. So it altogether, it took us, on that particular day we started at 7:30 in the morning and we finished at 2 o'clock in the morning. And patient did very well, and the patient she is totally asymptomatic now, and she has got a slight hoarseness of voice because of the vocal cord involvement. Other than that, she's okay. She got married also, and she has given birth to a child also. So this was one of the things which it was a teamwork, but it was very, it was very satisfying. And I always remember about these patients. Other than there are so many other tumors that we have.
Thank you for sharing your experience, doctor. What would be your message to our viewers today?
See, this is a time which it's a whole world is we are facing this coronavirus, this COVID-19 is a pandemic now, and there are lockdown all over the world, and slowly it's opening up. And the normal diseases cannot wait for that. Just because it's COVID, patient will not have a brain tumor. So we have to always aware that if we have a symptoms, not that you will be sitting at home, that you will not seek any appointment or seek a doctor because of the COVID. So you have to go, you have to seek a doctor. Okay, there are nowadays, one thing, the world has become more virtual, so you can always contact your doctor through phone or through video call, video conferencing, take his opinion, ask his how urgent it is. If it is really urgent, definitely your treating doctor will be able to treat you. None of us are sitting all throughout the COVID. We are operating when there is emergency, when the patient needs surgery, we are doing our work. So I suppose treatment has to be done. Just because of the COVID, a patient cannot die of a brain tumor or something. For example, there are patients can have as I didn't tell you, there are a lot of tumors of this, about 40% of these brain tumors can be malignant tumors. There can be tumors which from other areas come to the brain. So they are called secondary tumors. Those tumors we cannot wait. One of the common tumor happens in the brain called glioma. Now this glioma, it cannot wait for 3 months, 6 months, it will grow. So if you don't have the treatment done immediately, the patient can die of the disease. So if the treatment is done, and nowadays with so much of advancement of treatment, even the glioma patients can live longer. So definitely my advice to you, if any of the patients known to you in the neighboring the patients who do not have much access of this, of the facilities to contact the doctors, you are the people who can help him to see a doctor, how to contact a doctor, and can approach us all over India. Everybody will come and help you, whatever way, because the disease cannot wait. We have to live with corona. So when the treatment needs, we have to give the treatment. So that is my message, that whenever you have problem, you please come forward, contact us, we are there to help you. Thank you.
Thank you very much for a very informative session, doctor.
Thank you very much. Thank you for everything.
For appointments with Dr. Siddhartha Ghosh, please contact 89250 19766. I repeat, 89250 19766. Thank you, doctor.
Thank you.
Thank you, viewers.